Uh, in most cases, I mean, of course, there are certain exceptions to the rule. Here I put medication first because ear pain is one of the most terrible pains you could have. It's very, very, very bad, and that's actually what we do in the emergency room, is trying to calm the pain and not necessarily the infection. So yeah, try to take certain anti-inflammatories. Again, the same anti-inflammatories. They will help. Try to use. You can rinse your nose with water. I mean, boiled water after it cools down, or you could use certain over-the-counter medication like Afrin, which is oxymetazoline. What it does, it's constricts the blood vessels in your nose. And I know I'm talking about the ear, so I'm going to explain that the middle ear connects with the back portion of your nose and mouth. If you constrict the blood vessels there, probably the opening between the middle ear and the nose, it's gonna widen and liquid might get out, or air, in case you were on a trip in an airplane or in a car and you're feeling that like you're not hearing well and you have a lot of pain. Probably that might help you. Antihistamines, which some are over the counter, like Allegra or cetirizine, they will do a similar effect to the Afrin that I just said. Try to take or use certain natural herbs. Chamomile, in this case, it's helps soothe certain pain in the ear, so I would do it. I would take the chamomile and do an infusion, like let it boil in water for about 20 to 30 minutes, and then let it cool down and put it with a little, some drops on your ear. This might help. And put some warm towel on your ear, on your jaw. That might help you calm down the pain. I need to warn you that, of course, it's not necessarily going to resolve the problem right away. Even if you go to the ER and they do give you antibiotics, ear problems and infections tend to last for a little bit, like 4 or 5 days. And sometimes they bother a lot because you cannot hear through one of your ears. So just be patient and it will go away in most of the cases. If you start bleeding or having discharge, like I said, well, you should go to the ER.